Welcome. You're tuning in because, like us, you want to get up to speed on complex topics, and efficiently.
That's the goal.
Today we're tackling something called hypertrophic cardiomyopathy, or HCM. It's a heart condition in cats that's, well, surprisingly common.
It really is, and the mechanisms behind it are quite intricate. We've gone through some fairly dense medical source material on this.
Right, and our mission here is to pull out the most critical bits, the really interesting insights, and break them down for you.
Let's dive in.
Okay, HCM in cats. Let's start with the basics. What are we actually talking about here?
Okay, so HCM, basically, it's when the heart muscle gets thicker than it should. Specifically, we're talking about the walls of the left ventricle. That's the main pumping chamber.
Yeah.
And sometimes the septum, the wall between the ventricles, they thicken up sort of inappropriately.
Inappropriately meaning
Yeah.
there isn't another obvious reason for it.
Exactly. It happens without other heart diseases or systemic problems like high blood pressure or thyroid issues. That could explain that thickening.
So it's not like the whole heart just gets bigger uniformly. It's the walls thickening inwards.
Precisely. That inward thickening is key. It doesn't necessarily mean the overall heart size is huge, but the chamber inside gets smaller.
And that seems like it would cause problems with filling.
You've hit the nail on the head. That leads to the core issue, diastolic dysfunction.
Diastolic dysfunction. Okay, what does that mean in plain terms?
Diastole is when the heart muscle is supposed to relax and fill with blood. With HCM, the thickened muscle is stiffer, it's less compliant, so it just doesn't relax as well as it should.
Ah, okay. So it's harder for the ventricle to stretch out and accept blood.
Right. And because it can't relax properly, the pressure inside the left ventricle starts to climb, especially during that filling phase.
And that pressure has to go somewhere, I assume.
It does. It backs up. The increased pressure in the left ventricle pushes back into the left atrium. That's the chamber receiving oxygenated blood from the lungs.
Making the atrium work harder.
Well, it causes the atrium to stretch and enlarge over time because it's constantly dealing with this higher back pressure.
So a stiff ventricle leads to a bigger atrium. Sort of like a bottleneck.
Yeah, that's a good way to think about it. And the problem doesn't stop there.
Where does it go next?
That high pressure in the enlarged left atrium then transmits further back into the pulmonary veins coming from the lungs.
Which carry blood to the heart.
Correct. So you get pulmonary venous hypertension, high pressure in those lung veins.
And that sounds like it could lead to fluid issues.
Absolutely. If the pressure gets high enough, fluid can actually leak out of those blood vessels and into the air sacs of the lungs. That's pulmonary edema.
Fluid in the lungs, that sounds serious. Difficulty breathing?
Definitely.
Yeah.
That's often a key sign of heart failure in cats. And in some more advanced or severe cases, this can progress. You might get fluid building up in the chest cavity around the lungs. That's pleural effusion. Or even though it's rare, fluid in the abdomen, which is called ascites. This points towards biventricular failure, meaning both sides of the heart are struggling.
Wow, okay. Now, the sources also mentioned something about blood clots. ATE, I think?
Yes, AEE, arterial thromboembolism. That's a really, really significant and often devastating complication of HCM.
How does that happen?
Remember that enlarged left atrium we talked about?
Yeah, the one getting stretched out.
When it gets enlarged, the blood flow inside it can become sluggish, sort of stagnant in places, and stagnant blood is much more likely to form clots.
And those clots can break loose.
Exactly. If a piece of that clot breaks off, it gets pumped out of the heart into the main circulation.
Oh, no.
Yeah. It travels through the arteries until it reaches one that's too narrow for it to pass through, and it gets lodged, blocking blood flow.
And that often happens in the back legs, right? I remember reading that.
Very often, yes. The most common spot is where the aorta splits to supply the hind limbs, the sort of saddle area. It blocks blood flow downstream. Sudden paralysis of the hind legs, usually. It's incredibly painful. The paws become cold, maybe bluish. It's an emergency. Sometimes a front leg can be affected, but it's much less common.
That sounds truly awful for the cat and the owner.
Mm-hmm.
Okay, there was also mention of something called SAM and cysis, an outflow obstruction.
Right, SAM, systolic anterior motion of the mitral valve. This is another potential complication.
What's happening there?
Okay, so during sisal, when the left ventricle contracts to pump blood out,
Yeah.
in some cats with HCM, particularly if the septum is very thick, the mitral valve leaflet One of the flaps of the valve between the left atrium and left ventricle gets kind of pulled forward towards the septum.
Go forward.
Yeah, into the path where blood is trying to exit the ventricle into the aorta.
So blocks the exit.
It can, yeah. It causes what's called dynamic left ventricular outflow tract obstruction. Dynamic because it happens during the contraction phase.
And that makes the heart work even harder, I'd imagine.
It certainly can, and that same motion, Sam, can also prevent the mitral valve from closing properly during systole.
Leading to a leaky valve.
Exactly. Mitral regurgitation. Blood leaks back into the left atrium when the ventricle contracts, which just adds to the workload and the pressure problems in the atrium.
It really sounds like a chain reaction, starting with that initial thickening.
It absolutely can be.
So summing that up, which body systems are primarily affected by all this?
Well, obviously the cardiovascular system is front and center. We see congestive heart failure, CHF, that arterial thromboembolism, ATE, and arrhythmias, irregular heartbeats.
Okay.
Then, if CHF develops, the pulmonary or respiratory system gets involved, causing that difficulty breathing, the dyspnea.
Fluid buildup.
And sometimes the renal system, the kidneys, can be affected too. If the heart isn't pumping effectively, blood flow to the kidneys can decrease.
Leading to?
Potentially something called prerenal azotemia. Basically, waste products build up in the blood because the kidneys aren't getting enough blood flow to filter properly.
Got it. So heart, lungs, sometimes kidneys. Let's shift gears a bit. Why does this happen? Is there a genetic link?
Oh, absolutely. Genetics plays a huge role in many cases of feline HCM. It's much more common in certain families, certain breeds.
Which breeds specifically?
The best understood link is in Maine Coons and Ragdolls. In these breeds, a specific mutation in a gene called MYBPC3 has been identified.
MYBPC3, what does that gene do?
It codes for a protein called cardiac myosin-binding protein C, which is basically involved in the structure and contraction of the heart muscle.
And the mutation causes problems.
Yes. And it's inherited as an autosomal dominant trait. Meaning a cat only needs to inherit one copy of the mutated gene from either parent to be at increased risk of developing HCM.
So if you have a Maine Coon or a Ragdoll, that's definitely something to be aware of, a potential genetic predisposition.
Very much so. It's a key piece of information for owners and breeders of those cats.
But what about other breeds that seem prone to HCM, like Sphinx or British Shorthairs? Is it the same gene mutation?
Interestingly, no. Research hasn't found those specific MYBPC3 mutations in affected cats from breeds like Sphinx, Norwegian forest cats, Bengals, Siberians, or British Shorthairs.
So there must be other genetic factors at play.
It strongly suggests that, yes, HCM in those breeds is likely caused by different gene mutations, or maybe a more complex interaction of genes and possibly other factors. It's not a single-cause disease across all breeds.
That makes sense. It's complex. How common is HCM overall in cats? You said surprisingly common earlier.
Yeah, the estimates vary a bit depending on the study population, but some research suggests that HCM might affect up to maybe 15% of the general cat population.
15%, 1/5. That's actually quite high.
It is, isn't it? It really highlights why awareness is important, not just for owners of specific breeds, but for potentially any cat owner.
Definitely. So besides the known breed predispositions, Maine Coon, Ragdoll, Sphinx, British and American Shorthairs, Persians, are there other factors like age or sex?
Yeah, so while it can be diagnosed at almost any age,
Yeah.
from 3 months up to 17 years old,
Wow, that's a huge range.
it is. But the most typical age for diagnosis is often young to middle-aged, say 5 to 7 years old.
Okay.
However, there are some breed differences there too. Ragdolls and Sphinx cats tend to show signs or get diagnosed younger, often around 2 years old on average.
And what about older cats? If an older cat suddenly develops signs, is it likely HCM?
That's a good point. If an older cat, say over 8 or 10, develops a new heart murmur or signs of heart thickening, you'd actually be more suspicious of other causes first,
Like
hyperthyroidism, an overactive thyroid gland, or systemic hypertension, which is high blood pressure. Those conditions are more common causes of secondary heart changes in senior cats.
So HCM is often, though not always, a disease of younger to middle-aged cats. Any sex difference?
Yes, male cats seem to be diagnosed with HCM more commonly than female cats.
Interesting. Okay, so how would an owner even know? What signs might they see at home?
The signs can be subtle or sometimes quite dramatic. Things owners might notice include difficulty breathing or maybe rapid breathing, a decrease in appetite, sometimes going off food, completely anorexia. They might seem less active, less willing to play, exercise intolerance. Vomiting can occur, sometimes episodes of collapse or fainting, which is syncope, and sadly, in some cases, sudden death can be the first and only sign.
That's sobering. Is coughing a sign? People often associate coughing with heart problems in dogs.
That's a really important distinction. In cats, coughing is actually not a typical sign of HCM or heart failure. If a cat is coughing persistently, it's much more likely to be due to an airway issue like asthma or a primary lung problem.
Good to know. Coughing usually means lungs, not heart, in cats.
Ah.
What about what a vet might find on exam?
During a physical exam, a vet might pick up several clues. They might hear a heart murmur, typically a systolic murmur, meaning it happens when the heart contracts.
But not always.
Not always, no. Some cats with significant HCM can have no audible murmur. Another finding might be a gallop rhythm, an extra heart sound, either an S3 or S4 sound.
Like a horse galloping.
Kind of, yeah. It's an abnormal rhythm. The vet might also feel that the heartbeat against the chest wall, the apex beat, feels unusually strong or exaggerated.
Okay, and if there's fluid?
If there's congestive heart failure with fluid buildup, the heart and lung sounds might be muffled. The chest might feel less springy or compliant when gently compressed. You'd likely see that rapid, shallow breathing, and listening with a stethoscope might reveal crackles in the lungs if there's pulmonary edema.
And the signs of AT, the clot.
Right. For AT, the vet would check the pulses in the back legs, the femoral pulses. They'd likely be weak or completely absent. The affected limbs would feel cold compared to the rest of the body. The pads might look bluish or pale, and the muscles would be firm and painful.
And again, some cats might show no signs at all on exam.
Correct. A significant number of cats with HCM are asymptomatic, meaning they appear perfectly healthy on the outside, which makes regular checkups and sometimes specific screening more important, especially in predisposed breeds.
It really does highlight the value of those vet visits.
Let's circle back to causes quickly. Besides the known gene mutations, what else might be going on?
Yeah, the exact trigger is often unknown, pointing to a complex picture. We mentioned the MyBPC gene mutations. Other possibilities being researched include potential defects in other heart muscle proteins like myosin or troponin.
Okay.
Issues with how heart cells contract in response to signaling molecules like catecholamines, think adrenaline. Problems with calcium handling within the cells, which is critical for muscle function.
Right.
Also, potential abnormalities in the connective tissue matrix of the heart, maybe even the influence of things like excess growth hormone. And there's a theory that the outflow obstruction itself, if present, might actually stimulate further thickening over time, a sort of feedback loop.
So a lot of potential contributing factors being looked at. Any clear risk factors beyond genetic? The biggest known risk factor is definitely being related to a cat with a known familial MyBPC mutation. Offspring of affected cats are clearly at higher risk. Other specific non-genetic risk factors aren't as well defined.
Okay, let's talk diagnosis. How do vets figure this out definitively? You mentioned ruling things out.
Exactly. Diagnosis often starts with excluding other conditions that can cause similar heart changes. So checking for hyperthyroidism, especially in cats over 6, is crucial. Measuring blood pressure to rule out systemic hypertension is also key.
What about routine blood work?
Routine blood tests, like a CBC and chemistry panel, are often surprisingly normal in cats with HCM, unless they have complications like that prerenal azotemia we talked about, or maybe electrolyte changes if they're already on diuretics.
Are there any specific heart-related blood tests?
Yes, there's the BNP test, B-type natriuretic peptide.
BNP, how helpful is that?
Yeah. It can be quite helpful. BNP is released by heart muscle cells when they're stretched or under stress. So in a cat that has, say, a heart murmur or other suspicious signs, an elevated BNP level increases the suspicion of underlying heart disease, including HCM.
So it points you in the right direction.
It does, but it's generally not recommended as a routine screening test for all apparently healthy cats without symptoms. Its reliability for just picking up early, asymptomatic HCM in the general population isn't fully established, and there can be overlap with normal ranges.
Okay, so it's more useful if you already have some suspicion. What about actually seeing the heart? Imaging.
Imaging is absolutely fundamental. Chest x-rays or radiographs are often taken first.
What do they show?
Sometimes they show that classic Valentine-shaped heart.
Valentine shape. Why?
It happens when both the left and right atria enlarge significantly, giving the top of the heart silhouette that wider, rounded look, while the ventricles might look more pointed. X-rays can also show if there's obvious fluid in the lungs or chest cavity.
But X-rays aren't definitive for HCM.
No, they aren't. The heart shape can look normal, especially early on, and X-rays can't reliably measure wall thickness or differentiate HCM from other types of heart muscle disease that might cause enlargement. They give you a piece of the puzzle, but not the whole picture.
So it gives the whole picture.
Echocardiography, an ultrasound of the heart. That's really the gold standard diagnostic tool for HCM in living cats.
What can you see with an echo?
It lets us directly see the heart muscle, measure the thickness of the left ventricular walls and the septum. In HCM, we're typically looking for a wall thickness greater than 6 millimeter.
Okay, over 6 millimeter.
Right. And the thickening might be symmetrical, affecting the whole ventricle relatively evenly, or asymmetrical. Maybe just the septum is really thick, or just one part of the free wall. We can also see if the papillary muscles inside the ventricle are thickened. We assess the heart's pumping function. Often it's normal or even hyperdynamic, meaning pumping strongly, in early HCM. We measure the size of the left ventricle chamber itself. It's often normal or even small. And critically, we measure the size of the left atrium.
Which is usually enlarged, right?
Yes. Left atrial enlargement is a very common and important finding in significant HCM. The echo is also the best way to see that systolic anterior motion, swayum, of the mitral valve if it's happening.
Right, the valve getting pulled forward.
Yeah, and we can use Doppler ultrasound, which looks at blood flow, to see if there's obstruction to blood leaving the ventricle, and also to assess diastolic function, how well the ventricle is relaxing.
Can you see clots too?
Sometimes, yes. If there's a large clot sitting in the left atrium, it might be visible on the echo. It's important to interpret echo findings carefully, though. Things like dehydration can sometimes make the heart look slightly thicker temporarily, but significant thickening, especially with left atrial enlargement, is highly suggestive of HCM.
That sounds incredibly informative. Any other tests sometimes used?
Electrocardiography, or ECG, is sometimes done. It records the heart's electrical activity.
What does that tell you?
It can show if the heart rate is fast, which is common in heart failure, or sometimes slow if the cat is very sick and cold. It can pick up arrhythmias, abnormal heartbeats, which are more frequent in cats with HCM, though normal cats can have them too.
Okay.
In advanced cases, you might see atrial fibrillation. A specific pattern called left axis deviation is often present on the ECG with left ventricular hypertrophy, but an ECG alone can't diagnose HCM, it doesn't show the structure, and the ECG can even be completely normal in a cat with HCM, so it's supplementary, not diagnostic by itself. And measuring systemic blood pressure is vital, as we said, to rule out hypertension as the cause. Cats with primary HCM often have normal or even low blood pressure.
Okay. And lastly, you mentioned pathological findings. After death.
Yes, if a necropsy is done, the findings confirm what we see on echo: the thickened left ventricle or septum, enlarged left atrium, maybe thickened papillary muscles or mitral valve. Microscopically, the hallmark is seeing the heart muscle cells in disarray, not lined up properly, that's myofiber disarray, along with scarring and changes in the small blood vessels within the heart muscle.
Right, that confirms the diagnosis definitively. Okay, let's talk treatment. What happens once a cat is diagnosed?
Treatment really depends on whether the cat has symptoms, especially congestive heart failure, CHF, or if they're asymptomatic.
Let's start with CHF. If a cat is struggling to breathe.
Hospitalization is usually needed immediately. The priorities are to provide oxygen therapy, minimize stress, keep them calm and quiet, and manage the fluid overload. Keeping them warm if their temperature is low is also important.
And managing the fluid.
That primarily involves diuretics, with furosemide being the mainstay medication. It helps the kidneys pull excess fluid out of the body, relieving pulmonary edema or pleural effusion.
Are there risks with furosemide?
Yes, it's potent. We have to monitor carefully to avoid dehydration and electrolyte imbalances, particularly potassium loss. Kidney function also needs checking.
Okay. What else for CHF? Activity restriction? Diet?
Definitely activity restriction while they're in failure. One stable, moderate sodium restriction in the diet is often recommended for cats with CHF.
And owner education must be huge here.
Absolutely critical. Owners need to understand that even if their cat recovers from a CHF episode, HCM is a chronic condition. They need to know the signs of recurrence, how to give medications reliably, and the potential risks like AEE and sudden death. If the cat's on blood thinners, they need advice on monitoring for bleeding.
Okay, now what about medications used long-term or even for asymptomatic cats? There seem to be a few.
Right. So besides furosemide for fluid, pimobendan is a drug that's gained traction for CHF in cats with HCM. It seems to help heart function and possibly relaxation, but its role in asymptomatic cats isn't established yet.
Okay. What about ACE inhibitors, like enalapril?
ACE inhibitors, like enalapril or benazepril, are often used alongside furosemide for CHF, similar to how they're used in dogs. Their specific benefit just for HCM itself, especially in asymptomatic cats, is less clear, but they are commonly part of the CHF management plan.
And beta blockers.
Atenolol. Beta blockers like atenolol are interesting. They slow the heart rate, which can be beneficial, especially if there's that dynamic outflow obstruction, ISM. They might help with certain arrhythmias and maybe have a mild antiplatelet effect.
But not usually used in active heart failure.
Generally avoided in acute CHF, yes, because they can decrease the heart's pumping strength. Their role in asymptomatic cats is debated, sometimes used if there's significant obstruction or specific arrhythmias.
And diltiazem.
Diltiazem is a calcium channel blocker. It has some similar effects to beta blockers slowing heart rate, potentially helping with outflow obstruction. Some research suggests it might also improve diastolic relaxation and maybe even reduce the hypertrophy itself over time in some cats. But again, its role, especially in asymptomatic cats, isn't definitively proven.
Okay, what about preventing those terrible blood clots, AE?
That's a major focus, especially in cats with moderate to severe left atrial enlargement. Historically, low-dose aspirin was used.
But
More recent studies, particularly the EFFATAT study, showed that clopidogrel, another antiplatelet drug, is significantly more effective than aspirin at preventing the recurrence of ADE in cats who've already had an event.
so clopidogrel is preferred now.
Generally, yes, especially for secondary prevention after a clot, or in cats deemed at high risk due to significant atrial enlargement or sluggish blood flow seen on echo, spontaneous echo contrast.
Okay. Any other drugs mentioned? Nitroglycerin.
Nitroglycerin ointment or patches can be used sometimes for short-term stabilization in severe CHF, helping to relax blood vessels. Occasionally used longer-term in tricky cases, but usually not a primary therapy.
Are there contraindications? Situations where you wouldn't use certain drugs?
Well, as mentioned, beta blockers are typically avoided in acute CHF and used cautiously, if at all, in cats with active AEE, as they could potentially worsen peripheral circulation. If needed for an arrhythmia in that situation, a selective one like atenolol might be chosen carefully. ACE inhibitors need cautious use if there's significant pre-existing kidney disease.
Got it. Any alternative or additional drugs?
Spironolactone is sometimes added to furosemide in CHF management. It's a weaker diuretic but helps counteract potassium loss and might have other beneficial effects on the heart muscle. One quirky side effect can be facial itching or scratching in some cats.
Still itchy.
Or for very high-risk clot prevention, sometimes stronger anticoagulants like warfarin or low molecular weight heparin like enoxaparin are considered, but they require intensive monitoring. And as we said, clopidogrel is now really the go-to antiplatelet drug over aspirin for most high-risk cats. In rare cases with persistent fast heart rates despite monotherapy, combining a beta blocker and diltiazem might be tried, but very cautiously due to potential additive effects on heart rate and contractility.
It sounds like treatment is very individualized and needs careful monitoring.
Extremely. Regular follow-up is key. Owners watching for breathing changes, lethargy, appetite loss, signs of AEE, vets doing recheck exams, blood tests to monitor kidneys and electrolytes if the cat's on diuretics or ACE inhibitors. Repeat echocardiograms are often recommended, maybe every 6-12 months, depending on the situation.
And see if things are stable.
Exactly. To assess if the hypertrophy is progressing, if the left atrium is getting bigger, medication adjustments might be needed based on those findings. If the left atrium becomes severely enlarged or if systolic function starts to decline, then more aggressive clot prevention strategies become even more critical.
So, constant vigilance and adjustment. Is there anything owners can do on the prevention side, besides responsible breeding?
For an individual cat already predisposed or diagnosed, the main thing is trying to minimize major stressful events, as severe stress could potentially trigger decompensation into heart failure in a susceptible animal.
Okay. And the major complications to watch for long-term are?
Congestive heart failure, arterial thromboembolism with potential paralysis, serious cardiac arrhythmias, and unfortunately, the risk of sudden cardiac death.
Right. What about the overall outlook, the prognosis?
It's highly variable. That likely reflects the different underlying causes and the stage at diagnosis. We know, for instance, that cats with 2 copies of that MYBPC mutation, the homozygous cats, tend to develop more severe disease earlier in life and likely have a poorer prognosis.
Okay.
One significant study looked at survival times based on why the cat was diagnosed. Cats diagnosed while still asymptomatic had a median survival time of around 563 days, about 1.5 years.
Okay.
Cats presenting with fainting, syncope, actually did a bit better in that study, median survival 654 days. Those presenting already in congestive heart failure had a median survival similar to the asymptomatic group, 563 days.
And the cats with ADE.
They had the poorest prognosis, unfortunately, with a median survival of only 184 days, about 6 months.
But those are medians, right? Meaning half live longer?
Exactly. It's crucial to remember there is a very wide range within each group. Some asymptomatic cats live for many years, while sadly others progress quickly. Some cats survive an AD episode and do reasonably well for some time with medication.
Are there specific factors that predict a worse outcome?
Yes, the study found that older age at the time of diagnosis was associated with shorter survival. And perhaps most significantly, the size of the left atrium was a strong predictor. Larger left atrial size consistently correlates with increased risk of CHF, ATE, and shorter survival times across multiple studies.
So left atrial size on the echo is a really key prognostic indicator.
It seems to be one of the most reliable indicators we have for risk stratification, yes. But again, every cat is an individual.
It certainly seems like a very individual journey for each cat with HCM.
It truly is.
Well, this has been quite the deep dive into feline hypertrophic cardiomyopathy. It's definitely complex, the genetics, the potential causes, how it affects the cat, the treatments.
Absolutely. And while we've covered a lot of detail, hopefully having this foundational understanding helps you, as someone who cares about cats, feel more empowered to have informed conversations with your vet.
For sure. It gives you a framework.
Yeah.
Thinking about all this, it makes me wonder what other maybe environmental or dietary factors not really highlighted in our sources could potentially influence HCM development or progression? Or even just what bigger questions does this raise for you about overall feline heart health and what we still need to learn?
That's good food for thought. Always more questions to ask.
Indeed. Well, thank you for joining us for this exploration.